So I'm really delighted to have this opportunity. This is going to be a little bit of a shift because we've had so many really fascinating and wonderful research presentations. And this is kind of an introduction to a new program. And we're really excited to have the opportunity to do this in this venue. So I'll just dive right in. What I want to share with you today is a bit of information about the new program, the Duke Sexual and Gender Minority Health Program, that is co-led by Dr. Kathryn Whetten and myself, and our project coordinator is Ashley Blewett-Gulsh. And really, we're aiming with this program to improve the health and well-being of sexual and gender minorities in the Southern US and in the Global South, or in low and middle income countries. Whoops. So I thought it'd be appropriate, since we're talking about sexual and gender minorities, to start by letting you all know what each of our pronouns are. Ashley's not able to be on today because she had a prior commitment, but I'm Sara LeGrand. My pronouns are she, her. Kate's preferred, or Dr. Whetten's preferred pronouns are they, them, and Ashley's are she, her. And this is just a lovely book. It's called The Gender Book. If anyone is interested in a pretty cool resource about gender, it's a great kind of graphic novel approach to learning more about gender identity and expression. So the mission of the program that we've started, we formally had a launch in February, and then COVID happened. But we've actually been working on it for some time with a group of people. But our mission is really to improve the health and well-being of sexual and gender minorities in the Southern US, as well as the Global South. And we're talking about really millions of people by building on kind of our existing areas of excellence, which include research on sexual and gender minority health, clinical best practices, education and training, as well as a policy kind of arm that focuses on local, national, and international policies related to sexual and gender minorities. And we know that, of course, all of these have major influences on the health and well-being of sexual and gender minorities. And our vision, it's grand, but we have an incredibly strong team, and it's growing quickly. And I think I'm hoping today it'll grow even more. Is to become, really the best university and health system in the Southern period, to really be addressing the needs of sexual and gender minorities in the Southern US and the Global South. So you might wonder, okay, so why would you focus on the Southern US and the Global South? Well, a couple of reasons. One is that there are major gaps in the knowledge around sexual and gender minority health. When we think about physical health, mental health, social health, and well-being in both of these, contexts. Really, in truth, a lot of what we know about the health of sexual and gender minorities is from HIV research. And that's been incredibly important, and has given us a lot of valuable knowledge, because, oftentimes, including myself, including Kate, and I'm sure many others who are here today, oftentimes we're looking at factors that contribute to HIV risk, poor outcomes for people who are living with HIV. And so we learn a lot about, mental health, substance use, all the factors, housing, all these factors that influence people's outcomes. So, but one of the limitations with that is, it is still primarily focused on HIV, and largely it's been, the focus has been on sexual behavior. And so it's limited kind of the population of sexual and gender minorities who are reached by the research. So, of course, gay, bisexual, and other men who have sex with men were, kind of a focus early on. I think transgender women, particularly those who have sex with men, are getting, more and more attention, warranted attention. and perhaps transgender men who have sex with men as well. But that also leaves out a lot of other sexual and gender minorities. And the way that, when we talk about sexual and gender minorities, we're talking about both gender minorities, so based on gender identity, gender expression, and then sexual minorities by sexual orientation. And that includes not only sexual behavior, but sexual identity as well as attraction. And I've certainly found in my research that those things are not always concordant. And different permutations of that kind of triad excuse me, can lead to different health outcomes. So we have a lot to learn. But anyway, so there's really not that much known about sexual and gender minorities, not enough known about sexual and gender minorities in the Southern US, and certainly we have a lot of work to do in low and middle income countries. So also what we've learned, I think, through a history of research with the Center for Health Policy and Inequalities Research and the Duke Global Health Institute, is that there are some similarities in some of the factors that influence the health and well-being of marginalized populations in both the Southern US and low and middle income countries. And what that means is that it gives us an opportunity to actually really accelerate bidirectional learning and also bidirectional solutions to addressing health disparities. So there's a really great opportunity there. And, I will just say, there's some really incredible powerhouse universities, groups doing work with sexual and gender minorities, but there really isn't this presence in the Southern US, nor is there really a group that, I would say just rises to the top in terms of working in low and middle income countries. So why the Southern US? So we actually do have, the largest number of sexual and gender minorities. When you look by region, we have, 3.87 million sexual and gender minorities in the Southern US. So that may be surprising to some folks, because I think typically we think about the coasts and, East Coast, West Coast, but here we are in the South. Also, sexual and gender minorities living in the Southern US, I know that many people, who are participating in the symposium today have worked with sexual and gender minorities, but also, there are also parallels with non-sexual and gender minorities, who are at risk for HIV or are infected with HIV in terms of all of this kind of minority stress that builds up. So related to poverty, lack of employment, racism, and rurality is a big issue in the Southern US, and how that has an impact on sexual and gender minorities. Also, the experiences of stigma and discrimination, violence, again, it can be related to intersecting identities. And of course, I think we all unfortunately know that the protections that we have in the Southern US are insufficient, without a doubt, in terms of housing, in terms of employment, which further challenges health and well-being of these populations. And also less likely to have health insurance or access to medical care. And again, all of these factors contribute to poor health outcomes. And so this is one little snippet of an article that I found last year about a lack of trans-friendly doctors in the South, and it's basically an injustice. And this is quite striking that, there are over 500,000 transgender individuals that live in the South. And the U.S. Trans Survey, which is, a really incredible survey conducted nationwide, found that about 23% of transgender folks living in the Southern US didn't get health care because they feared that they didn't trust that they would get appropriate and high quality care. And so, over 100,000 trans individuals in that year didn't get the health care they needed. And so we clearly have a lot of work to do in the Southern US in this regard. What is really hopeful is I think that here at Duke, we have amazing providers, and we have work to do. There's no doubt about it, but I think that we're definitely on the right track with that. But clearly a need. And so why in the global South? I also know that many of you work in low and middle income countries and are, I'm sure, aware of the policies, laws around homosexuality, homosexual acts. These types of policies and laws range from inability to express your opinions freely in countries like Russia, or all the way to the death penalty. And so there are currently about 70 countries that criminalize homosexuality, and 12 that either do or can enact the death penalty. So severe consequences, and you can imagine the impact that could have on health and well-being. So so other things that we know about the global South is that we, in some countries, we are seeing improvements in social acceptance of sexual and gender minorities, but in many low and middle income countries, that's not changing, or it's actually gotten worse. So there are maybe some windows of opportunities in some places, but in others, it's actually declining in terms of political support. And we also know that social acceptance, like publicly, or lack of social acceptance, can certainly lead to lack of acceptance in interpersonal relationships, can create difficulties with employment, and also increases violence and discrimination. And so why now? So why are we interested in sexual and gender minorities of all types now? And it really is just this moment in time that it's been elevated. It's clearly been recognized how important this is, and how we need a kind of a collective response to make sure that we understand what the needs are, because in many parts of the southern US, as well as in low and middle income countries, we don't know. We don't have the data to really understand what the needs are. But we need those data in order to be able to design interventions, to inform clinical best practices. And also, again, critically, this is really, we really cover kind of the whole gamut. The policies are critically important in protecting the health and well-being of sexual and gender minorities. So, and this is evidenced by, in 2015, the NIH created the Sexual and Gender Minority Research Office, which was just huge, monumental, and that office has grown tremendously since it began as, I think, a two-person shop. And it's a really respected, office, and every institute within the NIH is expected to report on what projects they funded that are related to sexual and gender minority health every year. And then also, there's been a lot of activity within the UN and other kind of humanitarian and multilateral organizations that are really calling for us to pay attention to the policies and the discriminatory policies and structures that are creating these health disparities among sexual and gender minorities. So why Duke? We certainly have the right clinical and academic components. So as I was alluding to before with clinicians, we have just tremendous clinicians that are providing stellar care to both sexual and gender minorities. So we, of course, have our youth and adolescent gender clinic here, run by Dina Atkins. We have our adult gender clinic, and that was actually mentioned earlier, and also a LGBT clinic that Tiffany Kovas is in charge of, and of course Carly Kelly with the adult gender clinic. We have clinical psychologists, of course, Sarah Wilson, Dane Wicker, some names you've already heard talked about today. We really just have this incredible team of people who are so committed. It's just like we really have what we need, I think, to be successful with this work. And also, of course, speaking of the clinical side, but from the academic and the research standpoint, we also have a really strong history within our center. And I know, again, with many of you, here today have a long history of conducting research with sexual and gender minorities, both in the Southern US and in low middle income countries. I think Duke also really has a nice focus on interdisciplinary collaboration, interdepartmental collaboration that isn't always true in other universities. So we're really lucky that we have the opportunity to really pull people together to get all the people at the table that we need to do this work and do it well. And of course, Duke is about leadership, and that's what we want to do is really become the leaders in this, in these regions, these parts of the world. Duke understands the healthcare context, certainly, and is committed to Durham. And Durham for many years has kind of been a safe haven for sexual and gender minority populations, and certainly per capita has a pretty large population, and it's affirming to know that Duke is committed not just to sexual and gender minorities, but to helping the Durham community more broadly. So just to tell you a little bit about the structure of our program. So we have 3 arms. Our 3 areas of excellence include research, clinical best practices, education and training, and policy. And again, we have, really have this great expertise across all of these arms, but of course we're looking for more. I feel like we are, every week, like we're talking to new people and really building this group. And I think we're going to do stellar things. So in terms of research, we really do need to understand what the disparities are based on gender identity and or expression and sexual orientation, recognizing that those are different constructs, but can overlap. And then, develop innovative strategies for addressing those disparities. And I think one of the things that is true across the research that I've done, that Kate's done, that I think, kind of permeates across our center, is that we do use a participatory based approach. And so Dr. Rappa, it was really interesting to hear your talk, and I'd love to talk to you more about that actually. But that's kind of a value, I think, that we all kind of hold near and dear to our hearts, because it's just impossible to understand the needs that such a variety of people with different identities, different experiences have. And so in terms of clinical best practices, education and training, we do want to identify what those are and be able to educate medical providers and trainees both at Duke and well beyond in the Southern US, in low and middle income countries, and also train medical providers to train others so we can really disseminate this more rapidly, and not just rely on this program to really help and help more quickly. And in terms of policy, again, sorry.
Just you've got 1 minute left.
Okay. The policies are really important in influencing, the experiences that sexual and gender minorities have. And so this arm of our program looks at, is synthesizing policies in low and middle income countries, as well as the US, that have an influence on sexual and gender minorities. We really want to become a hub for this, and also a hub for publicly available data sets that include sexual and gender minorities that are identified, and help to develop policies that help to protect sexual and gender minorities. So I'm just going to skip really quickly to this slide. I can tell you about kind of what we've accomplished so far, but I know we're short on time. So I do think that there are many people here that would be wonderful additions to this work, and we'd love to have you join us. And so we are really actively looking for research collaborators, and plan to be setting up proposal writing groups, working groups. We'd also love help in identifying community members and stakeholders for our community advisory boards. You know, again, we do take that community-based participatory research approach very seriously. And so our contact information is there. I'm happy to share the slides. We would love to hear from anybody who's interested in joining our work.
Great. Thank you, Dr. LeGrand. Thank you.